the T-spine right here. I could drive a Matchbox car like this right here. So I couldn't get much leverage with my hand to do any manipulation because my hand wouldn't even be coming in contact with the table. So it's really hard to get T1, 2, 3 doing it in supine. Okay? Now, the book doesn't show this and you won't be tested on it, but one way to do it is actually to have them bridge up into your hand. So let me show you. So if I'm going to do T2, 3, pistol grip, I'm going to do right rotation, way up between the shoulder, the scapula get in the way, so that's a problem, so hug yourself. Okay, by having them cross their arms like this, they're protracting their scapula for you. Another way is to actually hand underneath the other, and that protracts it even further. Okay, and then I put my pressure down, and I just can't get enough leverage way up there. So bridge up for me. Now he's rolling down, and then I do it. Still not great, but sometimes it's effective. Okay? So it's a lot easier to sit them up, but you have to be evenly matched. Okay, so if you got a 250-pound, professional wrestler, and you guys are 110 soaking wet, you're going to have a hell of a time sitting them up and doing this thoracic, bear hug. So, PAs will work good for mobilization with movement, which we cover in the thoracic section, works good for those too. And that's what I prefer in some soft tissue techniques in the upper thoracic area, typically enough. You don't have to do high velocity thrust in this area to get better. And oftentimes, a lot of people at T1, 2, 3 are so stiff, they don't benefit from high velocity thrust anyway. They're too stiff. So high velocity thrust is good on a 0 to 6 scale when your mobility is ranked at about a 2 out of 6. So 1 is really stiff, 0 is ankylosed, 2 is a little stiff, and 3 is normal. So if you're at a 1 and you're barely moving much, you're not going to get a good thrust benefit anyway. So mobilization or grade 2s and 3s and 4s would be better. Yes, James?
So a couple of these are listed both under thrust and non-thrust.
Right.
And so if you were going to do this in a non-thrust manner, you still lean over them and just put.
Yeah, you can just do some modes or PAs with all of these techniques. You could just do a mode by having them inhale and exhale, and just go in and out of a grade 3 or a grade 4. If you do a grade 4, you lean in and then you just wiggle. I'll show you the difference right now. Actually, it's a great question. So let's just go back to the standard pistol grip T5-6. Okay, pressure on like that. I'm going to do pistol pointing up, so that's left rotation. Okay. I come down, squeeze, and I go, okay, inhale, exhale, and lean in, grade 3, and I can just do that. And do it with breathing or just do impulses. Okay. And then grade 4 would be lean in, and then it's a grade 4. Grade 1 would be just like just a little, not really moving. Grade 2 a little more. Grade 3 more through the range. Grade 4 wiggle, 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 wiggle. And grade 5 back off from the 4 and then thrust. Okay. So those are the different. And you can do that with all of them. Sometimes you incorporate. If you're planning on doing a thrust though, you probably want to do that actually earlier than later, because if you're warming up that joint with all these mobs, you're not going to get into the failure range of the tissue, which is essentially what you want, right? So if you go into the plastic range by mobilizing, you just stretch the joint. So you'll stretch the adhesion. But if you want to get a thrust to break the adhesion. So you don't want to heat it up and create plasticity or elasticity in the joint, sorry. You want to get it plastic and firm and then failure. And then not failure of the joint, but failure of the adhesion. So you do high velocity first. If that doesn't feel right or doesn't work well, then I'd go back to the mode. If they're really, really stiff, they're not ready for a thrust, then you just do the modes. And you could do it that way. I don't like that for mobing. That's just weird, and people are like, oh, he's bouncing. What are you doing? Especially if, I'm goofy, so I'm like, how you doing? How's your weekend? Weird. It's already weird. Weirder. So, but the PAs, that's great for that. Now that you can, they're like, you can incorporate massaging with that, soft tissue moves. Ribs a little weird, so you push on the rib. PAs. You can do a lot of stuff while they're prone in a comfortable position, like just have a little heat, or you incorporate a little massage, and then you don't spend a lot of time on that usually, but you got joint moves. Go ahead and get that joint moving. And then you can even work into active movement and stuff like that in that prone position with little press-ups or quadruped, and then have them work into progressive flexion. We'll talk about all that a little later, but that's more in the thoracic. So that's that with demonstrating the moves. So any of these you can do any of the grades of moves, including high velocity. Okay? And I just wanted to teach it from a handling perspective, and then practice the minute first, and then you guys can figure out, once you know what a 5 is, how to do a 4, a 3, a 2, and a 1. And I'm talking about Maitland grades, right, of mobilization. Okay. All right, so the upper thoracic technique, that's usually the go-to one, and I've seen you guys, we learned this on a clinical. Boy, you guys learned it sloppily or doing it sloppily. This is the way to do it right here. All right, sit down, kids. So go ahead and sit up. And oftentimes, if you just want to get distraction and relaxation in several techniques, you can just give them a bear hug and drop them. And that's sort of what's called a shotgun technique. You not really care where you're getting it. But if you want to be specific to it, and that's really stiff right there, then create a fulcrum with a towel roll or something like that. So what you want to do is use a towel roll or a sheet. Usually, if you don't have something this big, I have like a standard size, clinic towel. It's about like this, okay? And you roll it up into a bolster. You want it really firm. You can put it against your sternum, and you put the top of that against the more caudal spinous process, okay, or transverse processes, or all of the above. You're just putting it right there, and then you're going to create some distraction above it by a weapon. So you want to have them seated, and you want the table height to be good, and you want to be able to get close to them. There's a lot to it. You notice Dr. Olson is about just a slight head height higher than the patient is. Turn sideways, please. So say we're doing this segment here, where my finger is. Okay, and put that on there. And again, just like we did with our hand, we want to direct as much force right at the edge of that fulcrum that we can, and then do a distraction. So turn around again. All right. Now there's a lot of different hand holds. Olson shows he's gripping around the forearms with that and creating some flexion, a flexion distraction technique with this. The upper thoracic is, again, with the forearm, so you're just changing the position of the towel with this. So, and turn, actually stand up. So towel goes here at the caudal vertebrae, bend your knees a little bit. You can either put mid-sternum against him like this, or you can come around to the side and put the top of your chest into it like that. Okay? Now, because I got big solid pecs, I like that one. Okay, but that's the position you want. Now, when you're here, that's kind of weird. One guy was really kind of nervous and a little conservative, and put your hand like that. He was standing up. I put both hands over. I'm going to do a little stretch to your back. And you just realize, I learned this in juvie. He goes, what? And then I manipulated him. So anyway, don't say that. You got to know the people pretty good. All right, have a seat. So that's the position. You're really just creating a fulcrum, just like you did with the pistol grip, but it happens to be with a towel. Okay? So, press your hand across your neck. So I'm gripping his own forearms and I'm squeezing him there. You know, sometimes you can look up, but basically what I'm doing is I'm trying to pin the towel against the caudal vertebrae and flex the cephalid one away from it. So I got to really get a good squeeze, and then you scoop with the forearms and you lift. So I'm doing this. You can also lean them back and drop back to your other leg. So as you lift them up, you're squeezing on the lower part, and when you drop, your arms go up, and that causes the distraction. That's a little trickier. So let me show you the first one. Let's do that again. Right. Squeeze, lean back, okay, and then like that. Distraction with a little flexion, okay? And the other one is more you rock them, you lift them, you drop them. Okay. Which one you like better? The first one. Okay. Another one that's just weird because you're actually dropping them down, and then it's like a garbage can you're trying to dump out, and there's some crap at the bottom, like that. You're literally lifting it up and then letting it go to try to let it drop out. So you have to rock them, and then you drop back on your leg as you push up with your arms. Okay. I try the first one. You can fiddle with the second one a little bit, but essentially on the side it's like rock, and I'm actually kicking my heel back like I'm starting a Harley. I do it with the other side. Okay, good. All right. Actually, I'm more like it here.